Insulin resistance is one of the most common health problems almost nobody can name until the numbers on their lab report force the conversation. And by then, it may already be raising blood sugar, blood pressure, triglycerides, and long-term heart risk. I'm going to show you 8 warning signs doctors actually look for, what the key labs mean in plain English, and what has real evidence behind it, without the hype. Quick hello, I'm Dr. Schamma Salomon, a board-certified internal medicine physician. Everything here is general education, not medical advice. Your own doctor knows your history, your medications, and your labs. I don't. Deal? First, a one-sentence picture of what insulin resistance actually is. After you eat, blood sugar rises. Insulin is the hormone that helps move that sugar into your cells for energy. When cells stop responding as well, the body often pumps out more insulin to compensate. For a while, blood sugar can still look okay until the system can't keep up. That's why people can feel off long before a diabetes diagnosis. Sign number 1, a growing waistline, especially fat around the midsection. Doctors care about waist circumference because abdominal fat is tightly linked with insulin resistance and metabolic risk. This is not about shame or clothing size. It is about pattern. If your belt keeps moving out a notch while your arms and legs look about the same, that pattern is worth a medical conversation. Sign number 2, energy crashes after meals. You eat, especially a high-carb meal, then feel foggy, sleepy, or suddenly hungry again. That does not automatically mean insulin resistance. Lots of things cause post-meal fatigue, but together with other signs, it raises a flag that your fuel handling system may be struggling. Sign number 3, intense sugar or refined carb cravings. When cells are less insulin responsive, blood sugar and hunger signals can get noisy. Cravings alone prove nothing. Cravings plus weight change, family history, and abnormal labs, that's a different story. Sign number 4, dark velvety skin patches, often on the neck, armpits, or knuckles. The medical name is acanthosis nigricans. It can have several causes, but in adults it is classically associated with high insulin states. If you notice this, do not self-diagnose from a thumbnail. Get it examined. Sign number 5, skin tags clustering in those same areas. Again, not diagnostic alone. Pattern recognition matters. Sign number 6, elevated blood pressure, or blood pressure that is creeping up year after year. Insulin resistance and high blood pressure often travel together as part of metabolic syndrome. If your pressure is rising and your midsection is expanding, ask about the bigger metabolic picture, not just the cuff number. Sign number 7, abnormal lipids, especially high triglycerides and low HDL, the so-called good cholesterol. Many people only hear your cholesterol is fine when total cholesterol looks okay. Ask for the breakdown: triglycerides, HDL, LDL. The pattern matters more than one headline number. Sign number 8, labs that are almost abnormal: fasting glucose in the prediabetes range, elevated A1C, or a high fasting insulin when your clinician orders it. Prediabetes is not a mild curiosity. It is a warning light that metabolic risk is already elevated, and also a window where lifestyle change can still move the needle a lot. Quick check. Which of these is a diagnosis by itself? None of them. Diagnosis is pattern plus labs plus clinical judgment. If 3 or more of these are showing up, that is your cue to book a visit, not to panic, and not to start random supplements from a social feed. What should you ask for? Bring this list: fasting glucose, A1C, fasting lipid panel, blood pressure, and waist circumference. Depending on your history, your doctor may also check liver enzymes, kidney function, or other tests. If you already have diabetes, polycystic ovary syndrome, sleep apnea, or a strong family history, say that up front. It changes the conversation. What actually helps? The boring, evidence-based version. 1. Move your body most days. Muscle is a major glucose sink. Brisk walking after meals is one of the highest ROI habits I recommend to patients who are ready for a small start. 2. Prioritize protein, fiber, and whole foods so meals don't spike and crash as hard. 3. Protect sleep. Short, broken sleep worsens insulin sensitivity. 4. If you carry excess weight, even modest loss can improve insulin response. The goal is metabolic health, not a crash diet. 5. If your doctor recommends medication, that is not a moral failure. For some people, lifestyle plus medicine is the safest path to protect the heart, kidneys, and nerves. One safety note: if you have excessive thirst, frequent urination, unexplained weight loss, blurry vision, or feel seriously unwell, get medical care promptly. Those can be signs of markedly high blood sugar. And chest pain, severe shortness of breath, or neurologic symptoms. Emergency care. Call 911. You now know what insulin resistance is in plain English. 8 warning signs doctors weigh, which labs to discuss, and the habits with the strongest everyday evidence. Do this today. Write down which signs apply to you and bring that list to your next appointment. If this helped, subscribe. I'm building DrSchammaExplains so big medicine gets simple words. Next up, what your blood pressure numbers are actually doing to your arteries. Take care of yourself. For education only, always talk with your own doctor.